Hi everyone, welcome to another episode of Aesthetic Minutes Clinical Vignettes. Before we start, here's a reminder that if you'd like to see more before and after photos of my surgical patients, you can do so online. Just go to Instagram and search for the handle Danny Soares MD. There you'll find plenty of before and after photos of surgical patients as well as surgical technique videos describing operative procedures in detail. You can also get brief previews of upcoming Aesthetic Minutes videos to learn more about plastic surgery. On today's episode, we have a healthy 60-year-old female interested in facial rejuvenation. She has been contemplating revitalizing her face over the last 5 years and has now decided to proceed with treatment. Because we have followed this patient closely over half a decade, we have access to her Vectra 3D photographs over time, which provide some useful insight into the gradual aging of the face. Comparing her facial scan from 5 and 4 years ago to her current photos, we can see how the degree of jowl formation has increased, along with the added prominence of the neck bands and loose skin. She has also accrued additional photoaging of her skin, which now has more age spots and fine wrinkles. Finally, also notice how the upper eyelids have gradually aged to where her upper eyelid creases, also known as the supratarsal creases, are now less visible due to droopy excess eyelid skin. Despite this, she still displays many favorable features, including excellent scalp hair density and hairline, good brow position and shape, youthful cheek volume and projection, and of course, a sharp neck bone structure with a favorable cervical mental angle. These features predict a favorable outcome with surgical rejuvenation. However, there are also some other aspects of her face that are important to consider. The first concerns the type of earlobe attachment seen in this patient. In this case, we see a non-cleft earlobe insertion in which the earlobe is directly attached to the face. This type of earlobe insertion, though fairly common, is distinct from the other type, a cleft earlobe insertion, in which the earlobe is free. The non-cleft insertion type seen in this patient requires more attention to detail as it is at higher risk for a pixie earlobe deformity after facelifting. A pixie earlobe deformity occurs due to the gradual downward pulling of the earlobe due to the excess tension placed on the skin incision. Surgeons can help lower the risk of this issue by minimizing the amount of skin removed around the earlobe, as well as performing a careful tension-free closure of the incision. A second challenge in this patient relates to her prominent neck bands, which represent an elongated and droopy platysmal muscle that is now hanging low, obscuring her excellent bone structure. Platysmal bands cannot be fully corrected long-term with just a mini facelift, in which the platysmal muscle is only suspended laterally. Instead, the platysmal muscle must be shortened and retightened through a procedure known as an anterior platysmal plication, also known as a platysmoplasty. This procedure restores the platysmal muscle to its shorter and tighter configuration, characteristic of the youthful neck. In addition, because aging of the neck is related to the chronic repeated contractions of the platysmal muscle, neck rejuvenation exercises will not only fail to address this issue, but they will also potentially accelerate the problem. Based on the patient's examination, the following treatments were recommended: a high SMAS facelift with an anterior platysmoplasty to correct the aging of the midface, jowl, and neck, a fractional carbon dioxide laser skin resurfacing of the face to improve skin texture and tone, as well as to erase sunspots and reduce the fine wrinkles, and an upper blepharoplasty to help restore the youthfulness of the upper eyelids. If you'd like to learn more about the different types of facelifts and their applications, please watch our videos on that topic. Out of all the recommended procedures, the upper blepharoplasty is the simplest, often requiring less than 1 hour of operative time under just local anesthesia. The procedure entails removing a meticulously drawn ellipse of excess skin that is carefully measured preoperatively with the patient sitting upright and with the eyes closed to help ensure that only excess skin of the eyelid is marked for removal. The surgeon then removes the excess skin, revealing the underlying orbicularis oculi muscle. Excess loose muscle can then be removed if deemed necessary, and the excess fat deposits of the inner eyelid can be trimmed to help improve the shape of the eyelid crease. The surgeon then closes the incision, creating a clean, redefined upper eyelid crease. Because the upper blepharoplasty incision is placed in the upper eyelid crease, it is well concealed early on and typically imperceptible after only a few weeks. This patient decided to proceed with all the recommended treatments, which required approximately 5 hours of operative time and 2 weeks of social downtime. She healed well and recovered without any issues. Here are this patient's results 4 months post-procedure.